Hello everyone, welcome to HIM 225. This is lecture 3 of HIM 225. If you will, turn to page 536 in your textbook. And we're beginning with selection of OB principal or first listed diagnosis guidelines. And so this first guideline talks about a routine outpatient prenatal visit. And it tells us that for routine outpatient prenatal visits where there is no complication present, we use a code from category Z34, which is Encounter for Supervision of Normal Pregnancy. That should be used as the first listed diagnosis. These codes are not used in conjunction with any other codes from Chapter 15. Then we have codes for supervision of high-risk pregnancy. I'm going to go to pregnancy. Okay, I went to pregnancy, supervision of. And you can see we have a number of terms listed under this subterm. So, supervision of elderly mother, multigravida, primigravida. Remember, we said that was anybody who was 35 or over. High risk due to, we have a number of things listed here, and then we have normal. And Z34.9 first, Z34.0, specified Z34.8. Then we also have young mother here, multigravida, primigravida. And remember, we said that was anyone under 16. So let's look at Z34.0. That will take us to the beginning of this category. So if it's a primigravida, first normal pregnancy, we have these codes. Unspecified trimester, again, probably never use. And then we have first, second, and third trimester here. Other normal pregnancy, which means that they're not a primigravida, it's not their first pregnancy. Again, the unspecified and then the first, second, and third trimester. Encounter for supervision of normal pregnancy. Again, we have those same series of codes. So that is the category that you would use if in fact it's a perfectly normal pregnancy. Now, let's look at the next category, the next section, supervision of high-risk pregnancy. So for supervision of high-risk pregnancy, we are choosing codes from category 009. And these are used only during the prenatal period. For complications that occur during labor or delivery as a result of a high-risk pregnancy, we assign the applicable complication code from Chapter 15. If there are no complications during labor or delivery, then we are assigning the code of 080, Encounter for Full-Term Uncomplicated Pregnancy. For routine prenatal outpatient visits for patients with high-risk pregnancies, a code from category 009, supervision of high-risk pregnancy, should be used as the first listed diagnosis. A secondary Chapter 15 code can be used in conjunction with those codes if appropriate. So let's look at a couple of examples. In this first one, the patient's seen in her first trimester at 13 weeks for a routine prenatal visit. She also has a 2-year-old daughter. Well, if she has a 2-year-old daughter, she is not a primigravida. So we would be choosing, we would be going to, get back over here, supervision normal specified NEC because it's not first, so Z34.8. This would take us to first. We would come over and choose the first trimester, so Z34.81 would be the code that we would choose. Now she is 13 weeks pregnant, and so we can go to weeks pregnancy, weeks of gestation, choose 13, Z3A.13. In the next example, the patient is seen at 11 weeks for a routine prenatal visit. But the physician documents that she has iron deficiency anemia, so this is no longer a routine prenatal visit. He has to treat her for the anemia. So in the index, we are going to go to pregnancy complicated by anemia. And we can see that that code is 099.01. She is 11 weeks. She is in her first trimester, so we select that character of 1. So 099.011. Now, this tells us she has anemia, but it doesn't give us any other information about that anemia. So we have to add a code for that anemia. It's iron deficiency anemia, D50.9. And we look at this category. We don't have any pregnancy, excludes 1 or 2 notes, so we add that code D50.9. And then she's 11 weeks pregnant, so we are going to go to pregnancy, weeks gestation, Z3A.11. On page 537 in your book, it tells you that if a patient's high risk, that first listed diagnosis will come from category 009 for outpatient visits. ICD-10 has separate codes for different high-risk categories such as infertility, history of abortion, multiparity, preterm labor, and so on. But the Merck manual reports that high risk has no formal or universally accepted definition. But it goes on to list these additional factors that may complicate the pregnancy, and you can read those conditions here. So keep that in mind. Now, this first example on page 537, this is a pregnant patient at 10 weeks, presents for a routine prenatal visit. During her previous pregnancy, she had early pregnancy vomiting, and the physician documents a high-risk pregnancy. So if we go back into pregnancy, supervision of, remember we have to put in supervision of, and then high risk. If we look at high risk, we don't see anything about vomiting. So we have a specified NEC condition here. So our code will be 009.89, and we're in the first trimester, so we're choosing a 1 for that first trimester. She is 10 weeks pregnant, so when we go to pregnancy, weeks, gestation, we're at Z3A.10. Now let's look at the next example. This is a gravid patient who is 12 weeks pregnant who comes in for a routine prenatal visit. The patient had preeclampsia on her previous pregnancy, and the physician documents that she is high risk. So she has blood work done on this visit, and she is found to be anemic. The physician prescribes an iron supplement. So when we look again at this pregnancy supervision of high risk due to, we don't see preeclampsia here. So again, we have a specified NEC code that we are applying, 009.891. She is anemic, so we are going to be applying pregnancy complicated by anemia, 099.01, and then we're applying the trimester character of 1. We also have to code that anemia, so in the index, if we go to anemia, we use the default. She's getting iron supplements, but this doesn't say iron deficiency anemia. So if we go to anemia, D64.9 is the default code for anemia. That's what we're using here. And then for pregnancy weeks gestation, Z3A.12. Now, I want to point out to you that when you are coding from categories who have the 6th character that designates the trimester, the codes all need to be consistent. You'll notice that both of these codes in this example designate the first trimester. It would be an error if you used a 1 for one of these codes indicating first trimester and a 2 for another code indicating second trimester. So you don't mix these trimester codes up. Typically they should be consistent. Now, if we have an episode when no delivery occurs, and this happens often, OB patients come in for a complication, or they come in with false labor and they don't deliver and they go home. So in episodes when no delivery occurs, the principal diagnosis should correspond to the principal complication of the pregnancy which necessitated the encounter. So why did they come in? If there's more than one complication and they're all treated equally, then any of them can be sequenced as the principal diagnosis code. And it tells us that there are times when a woman may have to be admitted prior to delivery and then is sent home before delivery occurs, and that in these instances, the reason that she was admitted to the hospital is the principal diagnosis. So on the top of page 538, let's look at this first example. This is a pregnant patient at 13 weeks. She comes to the ER with dehydration related to hyperemesis gravidarum. The physician in the ER documents that the patient also has pregnancy-induced hypertension. So we are coding the fact that she has hyperemesis gravidarum. Now, the dehydration is not coded separately. You would think it would be, but it is not. When you run this scenario through an encoder, even though you document the dehydration, it does not code it. So, if we go to pregnancy complicated by hyperemesis gravidarum, that code is O21.0. Now, that is mild hyperemesis gravidarum. But what do we have going on with our patient? Our patient is dehydrated. She has a metabolic disturbance. So we are actually going to apply this code of O21.1, hyperemesis gravidarum with metabolic disturbance. Now she also has pregnancy-induced hypertension. So let's go to pregnancy. Complicated by hypertension. And this is hypertensive, it's hypertension complicating pregnancy. And it is gestational. She did not have this hypertension before she was pregnant. She does not have proteinuria or any other documentation associated with a problem. So we are going to go to category 013. And she is 13 weeks. She's in her first trimester, so we're at 013.1. Now we're also coding the fact that she's 13 weeks gestation, so our code is Z3A.13. Now your question for this lecture is to go to page 548 and look at exercise 22.3. I'm sorry, that is the wrong page number. You're going to page 553. So on page 553, question exercise 22.3, question number 7. And that will conclude this third lecture for chapter 22.